A new strain of bird flu, which killed a man in Louisiana earlier this year, has now been detected in dairy cows in Nevada. The detection, part of a national milk testing program, indicates the strain, previously linked to migrating birds and poultry, has spilled over into cattle.
Dr. Anne Rimoin is a professor of epidemiology at the UCLA Fielding School of Public Health, and she joins us now with more. Hi, Doctor. Nice to see you. Thanks for joining us tonight. Well, the CDC notes that the risk to the general public remains low, but what does the detection of this new strain of bird flu in cattle tell you about the evolution of the virus?
Well, thanks for having me. And yeah, this is really important news here. This is not the same variant that we've seen in cattle previously. This is a variant that we normally have seen in poultry, and that variant has been associated with more severe disease, the case in the Louisiana man who died and the teenager in British Columbia as well. And the big news here is that this really suggests that it wasn't just a single transmission from birds to cows, that there are probably multiple of these transmissions. And it just reminds us that there are a lot of strains potentially circulating, and cases are adding up. So with this potentially more virulent strain circulating now in cows, we really do need to pay attention.
All of this happening in the thick of flu season, schools across the country closing as influenza spikes. What can viewers do to stay healthy?
Well, you're absolutely right. We're seeing really high levels of flu activity across the country. And what's happening in one part of the country will obviously affect us here as well. So get your flu shot. It's not too late. And that flu vaccine does reduce severe illness and hospitalization. So good idea to do it now if you haven't done it yet. Wash your hands frequently. Flu is transmitted also by touch. So you get it on your hands from surfaces, and you rub your nose, rub your eyes, you're going to potentially get it. So wash those hands frequently. Stay home if you're sick. Wear a mask in crowded areas if you really want to drill down on preventing disease. It does help reduce exposure to viral pathogens, respiratory pathogens, especially if you're traveling. And with flu, there are antivirals that work to really make a difference. So you can take Xofluza or Tamiflu. Talk to your provider if you do think you have flu.
There is a solution for sure. You mentioned travel, so we have been following this story pretty closely as well. Globally, the CDC issued a level 2 travel alert about an Ebola outbreak in Uganda. So what do we know about this outbreak, and is there any reason for concern here at home?
So Uganda is dealing with another Ebola outbreak, and it's caused by the Sudan virus strain, which is different than the more well-known Zaire strain, which has happened more frequently where I work in the Democratic Republic of Congo. So there are confirmed cases in Uganda, but there are investigations occurring right now, and Uganda has dealt with these outbreaks previously. So they do know what they're looking for. There is a vaccine trial starting there locally for a new vaccine targeting this strain. But for the U.S., risk is very low. Ebola doesn't spread like flu, so it requires direct contact. So, I think that for those of us here at home, risk is low, but this once again reminds us that, we need to be paying attention to what's happening globally.
Covered several of the bases. Dr. Anne Rimoin, short on time. Thanks for being with us. Always good to have you. Be well.
My pleasure.
Thanks.